Your first step should be to use your hand sanitizer. Hand sanitize for at least 20 seconds, including your thumbs. Make sure you let this dry completely before your next step. Then you should go to your clean PPE cart and retrieve your gown. While donning your gown, you can tear it slightly in the back to make it easier to doff later. During this process, you should be using a buddy system so someone can tell you if you are completely gowned and covered in the back. They can also help read you the steps for donning and doffing so that you do not miss anything. Your next step is to don your mask. You can see here that I'm already wearing my surgical mask. It is appropriate to continue to use your surgical mask if you are entering the patient room for routine patient care, non-aerosolized procedures, and if your patient is also wearing a mask. You may now put on your face shield or goggles, per your preference. Your fourth and final step of donning your PPE is to put on your gloves. Make sure your thumbs are in the thumb holes of your gown before placing your gloves on. You should also ensure that your gloves and your gown are completely covering all of your skin around your wrists and your forearms. There have been many questions about double gloving. For now, at VCMC, we will continue to single glove, and you may perform hand hygiene over your external gloves. Once you have completed your patient care, please leave the disposable stethoscope in the room. You should start the doffing process by hand sanitizing the exterior of your gloves in the room for at least 20 seconds prior to removing your PPE. You may then remove your gown and your gloves. Often, when grasping the gown in the front and pulling away from our body, we see that the gowns start to break. Make sure you only touch the outside of your gown with your gloved hands and continue to remove your gown. While removing your gown, fold or roll the gown inside out into a bundle. Then peel off your gloves, only touching the inside of your gloves and gown with your bare hands. You may then place your gloves and gown in the waste container. If you need help doffing, there should be a doffing guideline posted on the inside of every room. After removing your gown and your gloves, make sure to hand sanitize again for 20 seconds. Hand sanitize on your way out, and then close the door behind you. Hand sanitize again after touching the outside door handle. Remove your goggles or your face shield from the back of your head by lifting the headband without touching the front or outside of the goggles or the face shield. You may now place this on the dirty table. Don't forget to hand sanitize. To remove your surgical mask, you can remove the elastics or the ear loops, or start with the bottom tie first and then the top tie. Hand sanitize again for at least 20 seconds. Using the appropriate decontaminant or wipe, it is now time to clean your goggles or face shield. Start by cleaning the outside of your face shield. You should then make your way to the inside of the face shield, including the straps. You should be wiping for at least 1 minute. Depending on the type of decontaminant you used, i.e. Clorox wipes or bleach wipes, your dwell time may differ. You should hang your face shield or your goggles on the wet hooks and allow it to dry appropriately according to your appropriate dwell time. While you're waiting for your respective dwell time to elapse, you should take another wipe and clean your dirty area, again wiping for at least 1 minute. Hand sanitize again for 20 seconds before you proceed to replace your surgical mask. Don't forget to move your face shield or your goggles from the wet hook to the dry hook, or if you prefer, keep with your personal belongings.